You wake up exhausted even after a full night's sleep. Your eyes burn, your joints ache. You're constantly fighting off strange symptoms: dry mouth, rashes, hair loss, brain fog, and no one seems to have a clear answer. Your doctor says it might be lupus. Then another suggests it could be Sjögren's syndrome. Maybe it's both. Maybe it's neither. And while you wait for answers, the symptoms don't wait. They interfere with your energy, your relationships, your ability to just live normally. You're stuck between confusing test results and unclear diagnoses, wondering what's really going on inside your body. If this sounds familiar, you're not alone. Millions of people, especially women over 50, find themselves trapped in this same medical maze. Sjögren's and lupus are two of the most commonly confused autoimmune conditions. They share so many overlapping signs that even experienced doctors sometimes struggle to tell them apart. But here's the good news. In the next few minutes, we're going to give you the clarity you've been craving. You'll learn what truly separates these two conditions, how to spot key warning signs early, and what steps you can take to get the right treatment and feel like yourself again. Because when it comes to autoimmune disease, knowledge isn't just power, it's relief. Relief from fear, from guessing, and from the silent damage that misdiagnosis can cause. So stay with us. By the end of this video, you'll finally have the answers your body has been begging for. What is Sjögren's syndrome? Imagine waking up with eyes so dry they feel like sandpaper. Your mouth feels like cotton, even after drinking water. You try to eat, but chewing becomes tiring, and swallowing is uncomfortable. Then, slowly, you start noticing more your joints ache, your energy disappears halfway through the day, and your memory feels clouded. It's easy to brush it off as aging, stress, or dehydration. But for many, it's something much more complex: Sjögren's syndrome. Sjögren's is an autoimmune disease, which means the body's own immune system turns against itself. But unlike some other conditions that attack specific organs, Sjögren's primarily targets the moisture-producing glands. This leads to its most common and frustrating symptoms: dry eyes and dry mouth. However, it doesn't stop there. Over time, the immune attack can spread to joints, skin, lungs, kidneys, nerves, and even blood vessels. This can cause widespread inflammation, chronic fatigue, and symptoms that mimic many other illnesses, including rheumatoid arthritis and lupus. That's why so many people with Sjögren's are misdiagnosed or remain undiagnosed for years. What makes it especially tricky is that Sjögren's can appear on its own, known as primary Sjögren's, or alongside other autoimmune conditions, like lupus or rheumatoid arthritis. This is called secondary Sjögren's. This overlapping nature often makes it hard to know where one disease ends and another begins. Women are most at risk, especially those over the age of 50. In fact, 9 out of 10 cases occur in women. Hormonal shifts during menopause can unmask or intensify symptoms, making this age group particularly vulnerable. The cause of Sjögren's isn't fully understood, but experts believe it's a mix of genetics, environment, and possibly certain viruses that trigger the immune system to misfire. While there's no cure, early recognition is key to managing symptoms and protecting long-term health. By understanding what Sjögren's really is, not just a dry mouth, but a systemic immune condition, you take the first step toward clarity. And as you'll soon see, that's what will help you spot the critical differences between it and lupus. 2. What is lupus? Now imagine a different kind of fatigue, the kind that doesn't go away no matter how much you rest. One morning, your joints swell. The next, you wake up with a strange rash across your cheeks, shaped like a butterfly. Your fingers turn white when exposed to cold, your chest tightens when you breathe. And the worst part? The symptoms keep shifting. You never know what tomorrow will bring. This is what life can look like for someone living with lupus, short for systemic lupus erythematosus, or SLE. Like Sjögren's, lupus is an autoimmune disease. But instead of targeting moisture glands specifically, lupus can attack almost any organ or tissue in the body: skin, joints, kidneys, brain, heart, lungs, and more. It's unpredictable. It flares up, then calms down only to strike again in a different place. What sets lupus apart is its systemic nature. It causes widespread inflammation that can affect multiple body systems all at once. One person might experience joint pain and hair loss. Another may develop kidney problems or neurological symptoms. It's often called the great imitator because it can resemble so many other conditions, which makes diagnosis a long and frustrating process for many patients. Lupus primarily affects women too, usually between the ages of 15 and 45. However, postmenopausal women can still develop it, and older adults may show milder but still life-altering symptoms. In fact, lupus in people over 50 can look very different, often mistaken for arthritis, fibromyalgia, or even general aging. Researchers believe lupus develops from a perfect storm of genetic predisposition and environmental triggers such as sun exposure, infections, or certain medications. These triggers confuse the immune system, causing it to attack healthy cells as if they were foreign invaders. There's no single test that confirms lupus, and no cure yet. But modern medicine offers a variety of treatments that help manage inflammation and prevent organ damage if the condition is caught early. What makes lupus truly challenging is how inconsistent it can be. One day you feel fine, the next you're in bed for hours. That unpredictability can take a toll on your body and your spirit. But understanding the full picture of lupus is the first step to taking control. And when we compare it side by side with Sjögren's, the differences and the dangers of confusing the two become much clearer. 3. Similar symptoms that confuse. Now here's where things get tricky. You're dealing with dry eyes, joint stiffness in the morning, extreme fatigue, maybe even a persistent skin rash. You go online and search your symptoms. It could be lupus. It could be Sjögren's. It could be both or neither. This overlap is what makes these conditions so confusing for patients and sometimes even for doctors. Both Sjögren's and lupus are autoimmune diseases. That means they can produce widespread inflammation, cause unpredictable flares, and trigger the immune system to attack healthy tissue. So, it's no surprise that they often share similar symptoms, especially in the early stages. Fatigue is one of the most common and one of the most frustrating. People often describe it not as simple tiredness, but as bone-deep exhaustion that doesn't go away with rest. This type of fatigue is shared by both conditions and can be debilitating. Joint pain and stiffness are also common in both. You may feel it in your fingers, wrists, knees, sometimes moving from one joint to another. The pain often mimics arthritis, but without the same joint damage you'd see on an X-ray. Then there's the skin. Lupus is famous for its butterfly-shaped rash across the cheeks and nose, but both diseases can cause rashes, dryness, and increased sensitivity to sunlight. In fact, many people with Sjögren's also report skin problems that are initially mistaken for lupus. Dryness is another shared clue, but it's more pronounced in Sjögren's eyes, dry eyes, that burn or feel gritty, a dry mouth that makes it hard to swallow or speak, even dry skin and sinuses. However, people with lupus may experience some of this dryness too, especially if their disease overlaps with Sjögren's. Quote, hair loss, memory issues, difficulty concentrating, sleep disturbances, these can all appear in both conditions. That's why so many patients bounce from doctor to doctor for years, receiving different diagnoses and treatments that only address part of the picture. Understanding where the overlap exists is essential. But even more important is knowing where the lines are drawn, because the treatments, complications, and long-term outcomes can vary widely. And that's what we'll start to uncover in the next section, the key differences that truly set these conditions apart. 4. Key differences in symptoms. While Sjögren's and lupus may walk side by side in many ways, they each leave behind a unique trail clues that can help doctors and patients tell them apart. Recognizing these differences is more than just academic. It can be the turning point that leads to a proper diagnosis and a better quality of life. Let's start with Sjögren's. The hallmark symptom here is dryness. Not just dry eyes or dry mouth, but a deeper, more persistent kind of dryness that gets worse over time. People often describe it as a burning or gritty sensation in the eyes, or a tongue that sticks to the roof of the mouth. It's more than an annoyance, it can affect swallowing, speaking, even dental health. And unlike lupus, which may cause dryness in some overlapping cases, in Sjögren's, this symptom is always front and center. Sjögren's also frequently affects the salivary and tear glands directly. Over time, these glands may become inflamed, enlarged, and less functional. Some patients notice swollen glands near the jaw or under the ears. Others develop cavities or mouth ulcers due to lack of saliva. These are signs that point strongly towards Sjögren's rather than lupus. Now let's look at lupus. While dryness can occur, lupus symptoms tend to be more systemic and unpredictable. The famous butterfly rash on the cheeks and nose is one of the most recognizable signs. But lupus can also cause fever, chest pain, shortness of breath, seizures, anemia, and kidney problems. It often flares without warning and can affect multiple organs at once. This internal organ involvement is a major distinction. Another important clue is photosensitivity. People with lupus often experience extreme reactions to sunlight. Even brief exposure can cause rashes or trigger a flare. Sjögren's patients may be sensitive too, but it's generally less severe. Lupus is also more likely to cause blood-related abnormalities, like low white cell counts or clotting issues, and it tends to strike younger often before age 40, though older adults are still at risk. In short, while both conditions share inflammation and fatigue, Sjögren's focuses more on dryness and gland damage, while lupus brings broader internal organ risk and immune system chaos. Understanding these differences isn't just helpful, it can be life-saving. 5. Blood tests and diagnosis. For anyone facing symptoms like chronic fatigue, joint pain, or dryness, one of the first questions is often, what kind of tests can finally tell me what's wrong? Unfortunately, when it comes to autoimmune diseases like Sjögren's and lupus, there isn't a single magic test that gives a clear yes or no. Diagnosis is more like detective work, piecing together blood results, symptom history, and physical exams. Let's start with the most common test in both conditions, the ANA test, or anti-nuclear antibody test. This test looks for antibodies that target your own cells. A positive ANA is common in both Sjögren's and lupus, but here's the catch. It's also found in many other autoimmune conditions, and even in healthy people, especially women over 50. So while a positive ANA can be a clue, it's just the beginning. For Sjögren's specifically, doctors often look for two markers, anti-SSA, also called Rho, and anti-SSB, also called La. These antibodies are more specific to Sjögren's and are found in about 60–70% of cases. If both are present, along with classic symptoms like dry mouth and dry eyes, the diagnosis becomes much more likely. Lupus, on the other hand, often involves a broader set of immune markers. One of the most specific is anti-dsDNA, an antibody that targets your own DNA. This is rarely seen outside of lupus and often indicates a higher risk of kidney involvement. Another important marker is anti-Smith antibodies, also specific to lupus, though found in a smaller percentage of patients. Complement levels C3 and C4 are also checked. These are proteins that help regulate the immune system. In lupus, they often drop during flares. In Sjögren's, they may stay stable or only slightly decrease. Beyond blood tests, doctors may order a lip biopsy for suspected Sjögren's. This involves taking a small piece of tissue from inside the lip to examine the salivary glands for immune cell damage, a very useful tool when blood tests are inconclusive. Ultimately, diagnosis comes from looking at the full picture. Blood markers are powerful tools, but it's the combination of symptoms, physical signs, and test results that lead to answers. And the sooner those answers come, the sooner the healing can begin. 6. Triggers and flare patterns. Living with an autoimmune condition means living with unpredictability. Some days are manageable. Others hit like a wave, unexpected, exhausting, and impossible to ignore. These episodes, known as flares, can be triggered by specific events or sneak up without warning. Understanding what causes flares and how they tend to behave is one of the most empowering things you can learn, especially when trying to tell the difference between Sjögren's and lupus. In both conditions, flares involve a surge of immune activity. Your body starts attacking its own tissues more aggressively, leading to inflammation, pain, and other symptoms. But the triggers and how each disease flares often look different. For Sjögren's, flares are typically slower to build. They're often driven by dehydration, stress, illness, or even long exposure to dry environments. Airplane travel, overly salty foods, or certain medications that reduce saliva or tear production can quickly worsen symptoms. The dryness becomes more intense. Your mouth might feel raw, your eyes scratchy and burning, your fatigue deeper than usual. Sometimes joints will swell, or low-grade fevers creep in. It's uncomfortable, but often manageable with rest and targeted relief. Lupus, on the other hand, is a master of unpredictability. Flares can come on quickly and severely. Common triggers include sun exposure, infections, hormonal changes, emotional stress, and even physical trauma. A single day at the beach or a mild cold can lead to a full-body reaction, rashes, chest pain, migraines, muscle aches, or even internal organ inflammation. The immune system misfires, and suddenly the kidneys, lungs, or brain can become involved. That's why early detection of a flare is so important in lupus. Another difference lies in the frequency and intensity. Sjögren's tends to be more steady, with lingering symptoms and milder flares. Lupus, however, often follows a relapsing remitting pattern, quiet periods, followed by intense spikes that may require hospitalization or urgent treatment. Knowing your triggers is half the battle. Keeping a symptom diary, tracking stress levels, sleep, diet, and weather can help identify what sends your body into overdrive. While you can't always prevent a flare, you can prepare, and sometimes even soften the blow. Understanding how your body responds helps you stay one step ahead, and in autoimmune disease, that kind of awareness is your greatest defense. 7. Long-term risks and complications. Autoimmune diseases don't just come and go, they evolve, and if left unmanaged, both Sjögren's and lupus can lead to serious, even life-threatening complications. That's why understanding the long-term risks is so important, not to create fear, but to inspire early action and consistent care. Let's start with Sjögren's 40. On the surface, it may seem like a mild autoimmune condition, just dryness and discomfort. But over time, that dryness can cause significant damage. The lack of saliva increases the risk of tooth decay, gum infections, and chronic mouth sores. Dry eyes can lead to corneal ulcers, light sensitivity, and vision changes. But the risks go deeper. In about 10% of patients, Sjögren's progresses to affect organs like the lungs, kidneys, liver, or nervous system. Some develop interstitial lung disease, which causes breathlessness and persistent coughing. Others face chronic fatigue, brain fog, or neuropathy, numbness and tingling in the limbs. One of the most concerning long-term risks is lymphoma, a type of cancer that affects the lymphatic system. People with Sjögren's have a significantly higher risk, especially those with persistent gland swelling, low white blood cell counts, or certain immune markers. This risk is rare, but real, and it's why regular monitoring is crucial. Lupus, meanwhile, is more aggressive from the start. The biggest concern is internal organ involvement. Lupus nephritis, for example, is a serious inflammation of the kidneys that can lead to long-term damage or even kidney failure if untreated. The heart, lungs, and brain are also vulnerable. Inflammation in blood vessels can raise the risk of stroke or heart attack even in relatively young adults. Then there's the emotional toll. Both conditions can lead to anxiety, depression, and social isolation, especially when symptoms are invisible or misunderstood. The unpredictability of lupus flares, or the constant discomfort of Sjögren's, can wear down confidence and strain relationships. But here's the hopeful truth. These risks aren't inevitable. With the right diagnosis, proper treatment, and consistent self-care, many people live full, active lives with either condition. The key is awareness, knowing what's at stake, and what steps you can take to protect your health. Understanding the long-term picture is not about fear, it's about power. The power to make informed choices, speak up early, and stay ahead of the disease. 8. Treatment paths compared. When it comes to autoimmune diseases like Sjögren's and lupus, treatment isn't about finding a cure, it's about controlling the storm. Managing symptoms, reducing flares, and protecting your organs long-term are the true goals. And while the two conditions sometimes share medications, their treatment paths are shaped by the very different ways they affect the body. Let's begin with Sjögren's ulcer. Because dryness is the defining symptom, treatment often starts with moisture replacement. Eye drops, artificial saliva, sugar-free lozenges, and nasal sprays all help relieve daily discomfort. Some people benefit from medications that stimulate natural saliva production, like pilocarpine or cevimeline. Beyond symptom relief, immune-modulating drugs are sometimes needed, especially if organs are involved. Hydroxychloroquine, an anti-malarial medication, is commonly prescribed to reduce joint pain, fatigue, and inflammation in both Sjögren's and lupus. In more advanced cases, immunosuppressants like methotrexate or biologics may be used to calm the immune system. Lupus treatment, on the other hand, is typically more aggressive. Because the disease can attack vital organs, controlling inflammation quickly is critical. In addition to hydroxychloroquine, many lupus patients require corticosteroids to reduce swelling and immune activity. Immunosuppressants like azathioprine, mycophenolate, or cyclophosphamide may be introduced for severe flares. Newer biologic drugs are also playing a growing role in lupus treatment. Belimumab, for example, targets specific immune pathways and has been shown to reduce flares and improve quality of life. But beyond pharmaceuticals, both conditions benefit from lifestyle medicine. A diet rich in anti-inflammatory foods like leafy greens, berries, omega-3 fats can help calm the immune response. Adequate hydration, especially for Sjögren's, supports moisture and energy. Stress reduction practices such as gentle yoga, deep breathing, or time in nature help regulate cortisol and prevent flares. Sleep is another powerful tool. Both Sjögren's and lupus patients often experience unrefreshing rest, so developing strong sleep hygiene can make a major difference. And don't underestimate the value of community. Connecting with others who understand your journey can ease the emotional weight of chronic illness. Ultimately, the most effective treatment plan is one that's personalized. What works for one person may not work for another. That's why open communication with your doctor and self-awareness of how your body responds is essential. Living with autoimmune disease is not easy. The symptoms don't always make sense. The names are hard to pronounce, and sometimes, even the doctors aren't sure what to call it. But with the right information, you can start to take control. You now understand how Sjögren's syndrome and lupus are different, how one targets moisture and glands, while the other can strike organs deep inside the body. You've learned about the blood tests, the triggers, the flares, and the risks, and more importantly, you've seen how proper diagnosis can be the turning point. You don't have to live in confusion anymore. You don't have to bounce between specialists or accept generic answers. The more you know, the more confident you can feel asking the right questions, choosing the right treatments, and taking care of your body in the ways that truly matter. And remember, you're not alone in this journey. At Active Healthcare, we believe that education is empowerment, especially for those over 50 who are navigating the challenges of aging, chronic illness, and wellness at the same time. That's why we create content just like this to help you live smarter, stronger, and healthier each day. So if this video brought you clarity, inspiration, or simply made you feel understood, consider subscribing to Active Healthcare. Leave a comment, share your experience, or tag someone who might need to hear this today. Because real health isn't about perfection, it's about progress, step by step, with the right support behind you. You're doing better than you think, and we're here to walk with you every step of the way.